Dr. Kraushaar, let's talk about the mask policy first of all. How and when will we know if this is successful?
Well, I think masks can be viewed as one tool in our armamentarium to respond to COVID. So, hopefully, not only will we change the way we behave in terms of wearing masks, but we will also be more vigilant about social distancing. And if we use, several different tools that we have, then maybe we'll start to see a decrease in cases. It's hard to say how quickly that would happen, though.
Are there any hard numbers put on that to see if this is going to be successful?
It's really difficult to track how people are responding to that. So, for things like distancing and how well people are staying at home, things like that, when businesses were closed, you could track things like cell phone data. For masks, it's really difficult to track. We would basically have to go out in the community and survey people. So I don't think that's something that we're going to do. So, a lot of that sort of evidence will just come in anecdotally. I don't know if you're like me, but prior to the governor's mandate, when I'd go outside, I'd see a lot of young people not wearing masks. And so that told me that, that still isn't commonplace in that age group. And so I'm hoping that we can normalize this so it just becomes a normal part of our routine. We know that our response to COVID is going to have to last months, potentially longer. And so we really want to just make this a normal part of our daily lives as much as, or as annoying as it is.
What kind of participation rate would you need for this to really make an impact on the growth rate of this disease?
I think you would really have to see it across the board. So you have to see that basically everyone who is unable to socially distance would be wearing masks. And the reason being is, if you wear masks inconsistently, you wear it at your work, but then you don't wear it when you're with your friends, it's not going to work. So it really has to be a community-wide effort.
In the news today, I heard that Texas ERs are now at 100% capacity. Any word on how the occupancy rates, the capacity rates are at ERs here in the Valley?
Well, the Southern Nevada Health District tracks emergency department stays through syndromic surveillance. So basically, we have access to data on, what percentage of emergency department visits are related to COVID or are in people who have symptoms that are potentially related to COVID. And what we're seeing is that currently about 4% of emergency department visits are related to COVID, compared to at the height of, or in the beginning of April when we were seeing our most cases here previously, something around 20% of the visits were related to COVID. So we haven't seen a dramatic uptick in the percentage of cases related to COVID in emergency departments, but we're keeping a very close eye on that.
Well, that's good news. And what does that tell you about the disease?
Well, one of the interesting things that's been happening lately is we've seen the cases really increasing rapidly in an alarming fashion, but we've seen hospitalizations increasing more slowly, and emergency department visits as well. And this was a little puzzling, but we looked a little bit more into this data, and what we saw was that the people who who have the highest rates of infection right now, they tend to be younger. So, people from 18 to 49, basically. And so these are people who are not necessarily as high risk of having severe outcomes. While older age groups, so over 65, their rates have stayed lower, and we haven't seen as high increases. And so that's good in that the people who are at most risk of severe disease are probably still maintaining the social distancing. The bad news is if we start to see COVID spreading really widely in the community, so if all age groups except for over 65 have COVID, then it's just a matter of time before the over 65 set get COVID. So, it's the fact of if you've got people in your family who have COVID, then your grandparent is eventually going to get sick too. So we really need to do what we can to protect the elderly and those with chronic medical conditions as well.
We hear over and over that testing and tracing is the key to getting ahead of coronavirus. How is that going in Clark County?
Well, there's always room for improvement. So we have staff who are working around the clock basically to every time we get a reported case, we work as hard as we can and as quickly as we can to reach out to that individual to find out who they've been in close contact with, to identify other individuals who need to quarantine. And we also look at employers, and we try to see, are there particular locations where we're seeing a larger amount of case, and we reach out to those employers. And so there's always room improvement. Thankfully, we've gotten a lot of support from the state as well in terms of resources, and we should be able to ramp up our capacity. And we are in the process of ramping up our capacity, but this is really, it's a lot easier to do contact tracing when you're getting 100 cases in a week instead of getting 1,000.
Mm-hmm. Are you noticing any trends in the contact tracing?
Well, we're really seeing that cases are coming from across segments of society. So it's not just one particular occupation. We're seeing it from the service industry. We're seeing it from the healthcare industry. Really, construction. So it's really cutting across the board. There are groups that appear to be at higher risk, which makes sense, such as healthcare workers. I think healthcare providers as a group are some of the highest risk. But really, we're seeing, when we see that people in many different occupations are getting sick, it really shows that COVID is spreading in the community pretty widely.
And kids return to the school in the fall in a fashion. Is the ability there to do testing on students and staff?
The Southern Nevada Health District has been working closely with the Clark County School District and other schools. And one of the things that we want to do is to make sure that schools have adequate support for testing anyone who's ill. So we've made that offer to Clark County School District, and and we're figuring out how to make that as smooth as possible. And some of the details are still in the works, but we definitely want to make sure that there are no barriers to testing anyone who could potentially have COVID. Because the sooner we test those individuals, the sooner we can identify if there are any cases in the schools and take appropriate action.
I wanted to get back to tracing for a moment because I wanted to ask you this question. Are you running into any kind of problems getting people to cooperate with the people that are asking the questions, trying to trace who they've talked to? There's a certain stigma attached to this disease, and maybe people don't want to have others know their medical status.
I think for the most part, people are pretty open, especially when we reach out to them directly. Part of the skill of being a contact tracer is being able to build rapport with people, to have some legitimacy, like some credibility. So if they know that they're talking to someone from the health district, they're more likely to divulge information, even personal information, than they would if just some other random stranger. So for the most part, people have been very helpful and open. That you always run into certain exceptions where someone doesn't want to divulge information, but for the most part, people are open. I think there's a general understanding in the community that this is something that's spreading throughout the community. Everybody is potentially at risk, and I think we need to do our best to make sure there's no stigma associated with it.
Okay, that's good news that people are cooperating. Are you able to put any kind of number on the number of people you've reached out to that they've gotten tested, and have been able to quarantine themselves?
I don't have those numbers, off the top of my head, but that is something that hopefully we can, as time goes on, we can report on that more publicly.
Okay. Well, Dr. Kraushaar, I thank you for joining us, and I'm sure we're going to want to circle around with you too as we move through this pandemic and get updates from the Southern Nevada Health District.
Thank you for having me.
Thank you, Doctor.